Hello and welcome. It's all quite clear now that COVID-19 affects many organs in the body, but recent studies have suggested that the heart is one of the organs that is perhaps more affected than many other organs in the body, apart from the lung, of course, that we know well about. Now, and this, according to some studies, again, seems to be more prevalent in younger people. So let's try and understand what we know about COVID-19 in the context of the heart, and whether you can do something to be a little more careful in coming days, even as, of course, we search for either a cure or a vaccine. To discuss this, I'm joined by Dr. Sameer Gupta, an interventional cardiologist at the Metro Hospitals and Heart Institute in Delhi. He's a highly skilled cardiologist who specializes in interventional cardiovascular and peripheral procedures. He completed his medicine residency at Penn State University and his fellowship at the University of South Florida, and also an interventional cardiology fellowship at the University of Chicago. Dr. Gupta, thank you very much for joining us. You're also someone who's contracted coronavirus and come out of it quite well. So I'm going to ask you about that as well. So tell us first about, as a cardiologist, what are you seeing today in terms of either the symptoms or the progression of the disease?
As far as COVID is concerned, the COVID does affect the heart, and also patients who have heart disease have a higher incidence of having bad problems with COVID. So it's kind of a double-edged sword, that not only do patients who have heart disease have a higher incidence of having bad prognosis, but also COVID causes heart problems. So, if somebody, we've seen that patients who have heart failure, which means that the heart muscle is weak to begin with, those people who've got blockages and what we call coronary artery disease, these people have a higher incidence of bad prognosis with COVID, and they have higher incidence of death also with COVID. Also, some of the risk factors that cause these problems, like diabetes, hypertension, these also increase the risk of bad problems with COVID. Now, COVID, on the other hand, in somebody who does not have heart disease, causes the entire spectrum of heart disease. What I mean when I say this is it increases the risk of arrhythmias. Arrhythmias are abnormal heart rhythms. So sick patients with COVID can have arrhythmias because of COVID. We've seen that there is a higher incidence of muscle weakness that we see in patients with COVID. We've seen that there is a higher incidence of heart attacks we see with COVID. So it causes the entire spectrum of disease, and also patients who have heart disease are at a higher risk of bad prognosis.
Right. So amongst the patients that you've treated, what are the kind of trends that you've seen, and have patients that you've treated come back later with problems to do with the heart?
So, I'm primarily a cardiologist. I'm an interventional cardiologist. So I'm not treating COVID patients directly.
Right.
And but we do get consults. We do see patients who have either contracted COVID in the past, or patients with heart disease who now have COVID and go to another facility. So the prognosis has not been very good in some of these patients. I remember one patient distinctly who recently came in over the last few months. He had a massive heart attack. We treated him. He went home. Then he developed COVID after a few weeks, and then he had a bad prognosis with that, and he ultimately died. So we are seeing these people come back with COVID. We are seeing patients who've had COVID come in now with other heart issues. So we are seeing a lot of this. And like I said, every day we're learning something new about this disease.
Right. And I mean, you did refer to a patient who had come back to you. So, and these are people also who have recovered from COVID technically, but have subsequently shown to have some kind of heart issues.
Yeah. So, when you look at the heart issues with COVID, they come in multiple flavors, right? So there is this thing called cardiomyopathy that we are seeing in these people. Cardiomyopathy basically means that the muscles of the heart become weak. Okay. And there's also a higher incidence of, there's something called stress cardiomyopathy. So we are seeing these kind of patients coming in who have COVID, recovered from COVID, and now come back with heart failure. And then we see they've got weakness in the heart muscle. Now, there is some data to show that sometimes the weakness of the muscle is temporary. So we don't have long-term studies yet, right? Like, because the virus is only 9 months old. But there are some small reports that are saying that if you give medicines the heart function may come back. There is this special thing called stress cardiomyopathy. You're seeing a higher incidence of stress cardiomyopathy in people in the COVID era also.
Right, and when you look at those who've let's say shown some sort of symptom of heart condition post-COVID or post-recovery from COVID, any demographic similarities in terms of age, gender, and so on?
No, so that incidence right now is very small because it's not that everybody gets this, right? The incidence is not very small. So it's difficult to quantify and put that, it's older, younger. But what we are seeing in the other side, that those people who do have heart issues like myocardial injury and heart failure during the time of COVID, right? During when they're sick with COVID, they get all these problems. They're typically older people. They're people who have some of the risk factors already, like hypertension, diabetes, pre-existing heart disease, and then they develop these complications of COVID in the heart also. There's also a question of myocarditis. Myocarditis is weakness of the muscle of the heart because where the heart muscle swells up of sorts, if I was to explain it. Now, when we talk about myocarditis, the question comes up that is it the virus which is causing this myocarditis and the heart muscle injury, or is it that everything else which is going on in the body, like the inflammation which is going on in the body, and the heart becomes the innocent bystander? Okay. So when we look at this myocarditis, cardiomyopathy type thing, what we are finding is that from all the autopsy studies and data, that the heart is kind of the innocent bystander for everything else that is going on, right? At the end of the day, our entire body lives in a sort of an equilibrium. Everything is codependent on each other. So if there's a massive infection or a massive inflammation which is happening in the body, it does affect the heart also.
But is there anything to say that at least that the one study that the New York Times quoted that the heart is more affected than other organs?
So, if you look at the entire system, right, the lungs and the heart are the two organs which are primarily infected, and also the coagulation system. The coagulation system, what happens is that in COVID, what you're finding is the blood kind of becomes thick, if I was to say it. Right, the blood becomes thick because there are various changes in the coagulation pathway that happen, and there's a higher incidence of having blood clots. So the blood clots, they go into the lungs, and we are seeing a lot of massive blood clots in the lungs, which are also a cause of death. So the heart, the lungs, the vasculature, these blood clots can happen in the brain, they can happen in the arm, they can happen in the legs. We are seeing a lot of that.
Right. Right. So, as you look ahead, I mean, one of the questions is, which people I'm sure would like to ask is that if I'm already a patient, I have some heart condition, how do I be more careful? Because one of the things you're saying is that people who have come with a heart problem but have developed COVID subsequently.
Yeah, so these people are definitely at a higher risk, and what I'm finding now, when I go out on the street, like I live in Delhi, and Delhi has, I would say we are back to about 75 to 80% of pre-COVID traffic, right? The streets are flooded. The good thing is everybody is at least wearing a mask. Even if the mask is on the chin, at least they're conscious enough of wearing a mask. So, and now what I'm seeing is a lot of caution fatigue, that people are very cautious to begin with in March, April, a little part of May. And now time has gone by, people are getting fatigued. They're like, life has to go on. Like, oh, look, Delhi numbers are down. But what I would like to remind everyone is that, even though we might be having 700-800 cases a day, you don't want to be one of those 700 cases. For you, it is just that one that matters. The rest of the 699 become obsolete if you are that one. So please take caution. Please do not get caution fatigue. Please be vigilant. Do not go for unnecessary get-togethers. Do not go out and socialize just because you're bored. You cannot get into caution fatigue. It's very important. And also take your medicine. There were some patients we were seeing in the initial part of lockdown where they were either, they were unable to procure medicines for whatever reason. I mean, medicines were available, but they got lazy. They said, what, forget it. I'm not, 2-4 दिन से क्या फर्क पड़ता है type thing. And they came back with complications, not of COVID, but with heart complications because they were non-compliant with medicine. So please take your medicine. If you have diabetes, please take a diabetes medicine. I cannot stress this enough. And also, if you're home, very important to continue exercising, to continue working out, because that is also something we are seeing, that people are not working out. They're like, it's lockdown, I don't want to go out. Please work out. Please keep yourself healthy. But that is very important.
And that keeps the heart alive and kicking as well. I mean, in a metaphorical way.
Yes, definitely. Cardiovascular fitness is extremely important. And it's not just, and one more thing which I would like to point out over here, Govind, is that what was happening in the initial part of the lockdown was, and some of it is even existing today, is that people are hesitant to come to the hospital. I got a few calls, I'm having pain and I'm having chest pain and I'm having difficulty breathing, I'm sweating. Doctor, what should I do? And I'm like, you might be having a heart attack. You need to come to the hospital, like now. And the patients are like, doc, but what if somebody has COVID? I don't want to expose myself. Do I really have to come? And, heart disease has not gone away. Heart disease, even today, Govind, is the number one killer in India. Right? It is a top killer in India. If not one, it's number two. It's somewhere in that range. But you can still have a heart attack. Yes, you can have COVID too, but you can still have a heart attack. So please don't ignore your symptoms.
Right. And, you mentioned 700 cases, and you were also one of those 700 and suffered from it. So tell us about your experience.
So I remember distinctly what happened. It was a Monday, and I got up in the morning with a tickle in my throat, with a little bit body pain. And I said, you know what? It could be anything, right? I mean, you have a tickle in your throat. You don't think too much about it. The COVID is not the first thing. Though I was exposed to a few COVID patients working in the hospital. I'm a cardiologist. People were coming in with heart attacks. And in the middle of a pandemic, you don't know who has COVID and who does not have COVID. So I got up with a tickle. I worked the entire day. I started having some back pain. And I said, you know what, maybe it's the way I slept. Maybe it's the lead I wear during the procedures. And then I went to sleep. I was very tired. I went to sleep and I woke up at 4 a.m. with a fever. And I looked at myself. I'm like, oh my God, this has to be COVID. This cannot be anything else. And I woke up my wife. I told her that, listen, I've got a fever. And then we immediately did physical distancing. She went in the other room, started wearing a PPE kit to interact with me. And a few hours later, even she had fever. So, so we both got COVID. Thankfully, it was a mild version. I just had fever for a few days, and then my oxygen saturation and everything else was good, thankfully. And I recovered. I did my entire 2-3 weeks of quarantine. I actually, I went beyond the recommendations because I said, no, if I want to go back into the workforce, I have to ensure that I am not at all even 1% infected. So I did 2 negative tests just for my own satisfaction. And then I went back into the workforce, and then actually I even donated my plasma.
Right. Yeah. And I'm assuming both you and your spouse recovered at the same time?
Yeah. So, it was variable. Actually, I had symptoms for about three days, max 4 days. She had like very mild grade fever for about 5-6 days. So yeah, but then we finished our quarantine together. And, we did the entire physical distancing. And, as healthcare professionals, you don't realize, but a lot of healthcare professionals across the world, what they're doing is they're doing physical distancing even from their loved ones. So when the cases started going up, and I knew that there were people coming into the hospital with other symptoms who later on were found to have COVID, I started doing physical distancing from my parents. My parents live in the same building, and I meet them 2-3 times a day. So I told them, much to their dismay, I said, listen, the cases are going up. So I don't know if I'm going to be exposed, and I don't want to expose you if I might be a symptomatic carrier. So I actually started interacting with them only with wearing a mask. I did that, and that is the reality of what many healthcare professionals across the world are doing. I know people who've not hugged their child for 6 months. They're like, we just can't take the risk.
Right. Last question, Dr. Gupta. So as you look ahead, and given your own personal experience and the experience that you gained from treating patients who are obviously, these are cardiology cases, what's your sense? I mean, do you think we have some control on this disease? Do we know more? I mean, we of course know more than what we did earlier, but would you say, for instance, our sense of control is at least 50% now, as opposed to nothing maybe 4 or 5 months ago? Or do you feel we still have a long way to go?
I think this is a great question, Govind. And the thing about this disease is that every day we are learning something new. And what is also very interesting about this is that how the entire medical community and the best scientific minds in the world have come together to try and help and be a contribute in the pandemic. If you go back in time and you think, I think in the first week of January is when the New England Journal paper came out with COVID, and they gave the genome, right? And today we are in August, and we know so much more. If you go back and see the timeline, initially it was the masks are not helpful. Then they came and said masks are helpful. Then they said hydroxychloroquine is not good. It's good. Then they said hydroxychloroquine is not good. So every day now new treatments are coming up. We know a lot more than what we did 6 months ago. And 6 months later, we will know a lot more than what we know today. So I think it's very gratifying as a scientist, as a cardiologist, as a doctor to see how everybody's come together.
Right. That's a wonderful note to end on, Dr. Gupta. Thank you very much. And I do wish you and your colleagues and team members all the very best in fighting this dreaded disease.
Thank you so much, Govind. Thank you.
Thank you.